have the largest adult and youth incarceration gap. We face one of the largest opportunity gaps in terms of educational outcomes. We have some of the worst healthcare disparities as well, not only in terms of life expectancy, but other health-related issues as well. So part of the reason why to convene this conversation is because we know that in our community, there's a lot of concern about the efficacy of the various vaccines related to COVID. We know our community has been hit harder than any other community. That is Black folks when it comes to the health consequences and the harms associated with COVID. And so we want to make sure we can get good information to our community about these issues, that they can make smart choices that'll inure to the benefit of our community. And so the Black Empowerment Coalition, we just want to get good information, fact-based, evidence-based information to our community about issues of economic justice, justice in mass incarceration, justice in terms of economic opportunity, justice in housing, justice in healthcare, so that people in our community can make smart decisions about how we move forward in terms of public policy. So again, thank you, Pastor. Thank you for your leadership in organizing tonight, and all of your leadership in terms of work we're doing at the Black Empowerment Coalition. I'm looking forward to this conversation.
Thank you, Shavar. Truly appreciate it. And again, we want to welcome all of our guests, our attendees who are here for this conversation. This is just a straight talk conversation regarding the COVID-19 virus and also the vaccines. We know that people of color have been adversely affected by this pandemic. And so with all of the information out there, we felt as though there's never enough information. And sometimes being repetitive in sharing that information is important. And so I am honored just to share in this discussion, to lead this discussion, as we have two incredible panelists who will be sharing with us tonight. Let me just take a moment and introduce them. First, we have Dr. Lisa Jenkins. Dr. Lisa Jenkins is a pediatrician who has been in practice for over 20 years. She was born and raised in New Jersey. She is a graduate of Seton Hall University and Howard University School of Medicine. Dr. Jenkins finished her residency in pediatrics at University Hospital in Newark and recently obtained her master's in public health and urban health administration at Rutgers University. Dr. Jenkins has worked in many capacities. She's worked as a house physician at Trinitas Hospital in Elizabeth, North Hudson Community Action Corporation, where she provided primary care to well and sick children, performed physicals for children, and enrolled, or those children enrolled in early intervention program in children in the local school district. After her time at North Hudson Community Action Corporation, Dr. Jenkins decided to take a leap of faith, amen, and return to school to pursue a master's in public health. In 2012, Dr. Jenkins enrolled at University Medical Dentistry in New Jersey, School of Public Health. Dr. Jenkins obtained her Master of Public Health degree with a concentration in urban health administration in the fall of 2017. Currently, Dr. Lisa Jenkins is a medical specialist for the Department of Health and Mental Hygiene in the city of New York, with a concentration in urban health administration. Dr. Jenkins has received several awards in her career, but being recognized as New Jersey's, or one of New Jersey's, favorite kids docs in December of 2012 sticks out as a favorite for her. Dr. Jenkins' mission is to improve the safety and psychological well-being of infants, toddlers, and school-age children. I present to you tonight, Dr. Lisa Jenkins. Along with Dr. Jenkins, I want to introduce you to Dr. Chris Purnell. Dr. Chris Purnell is a dynamic physician leader and social change agent. In her public health practice, her focus is health justice, community-based advocacy, and population-wide health promotion and disease prevention. Recently, she joined University Hospital in Newark, New Jersey, as the first Chief Strategic Integration and Health Equity Officer. She oversees a portfolio which includes population health, strategic planning, community affairs, and the human experience. Her office is responsible for health equity strategy development and integrating equity and inclusion within the system across all operations. Dr. Chris graduated cum laude from Princeton University before attending Duke University School of Medicine. She received her Master of Public Health from the Columbia Mailman School of Public Health and completed the Johns Hopkins Bloomberg School of Public Health General Preventative Medicine residency. Dr. Purnell is a fellow of the American College of Preventive Medicine and holds an appointment as a clinical assistant professor at Rutgers, New Jersey Medical School. Dr. Chris is a frequent contributor across television, radio, and print media, leveraging her lived experiences and expertise as a public health physician and health equity champion. I am pleased to present two dynamic doctors tonight. These ladies are about it and doing their thing. And tonight we're going to have an open and candid discussion regarding COVID-19. So I'll open the floor up. Ladies, you can jump in. First question. 1 year ago, well, last night I was watching the news. President Biden, Vice President Harris, and their spouses were at the White House. Candles were all on the stairways leading up to the White House. They took a moment to remember 500,000 lives that were lost due to the coronavirus. Just a year ago, in a matter of 1 year, we've lost 500,000 lives. What do we know, doctors, about COVID-19 now that we did not know a year ago?
Well, I'll start. My father, Timothy L. Purnell Sr., was one of those 500,000 Americans who lost their life to this unprecedented public health crisis, as well as two of my cousins, Frankie Boswell Jr. and William Boswell Jr. And so I have to speak their names because the president and the vice president recognized the loss, because unless we intentionally reflect and remember, we can't heal as a nation. And I lost my father during a time when we knew so little. Here was this novel infectious agent that was ripping through the globe. We don't have one standard or approved treatment for coronavirus. We have investigational therapies. We do understand the structure of the coronavirus that has enabled us to produce two vaccines that are very safe and very effective. So that's where I'll start. I said that's what we know more than we did not know a year ago.
Okay, Dr. Lisa.
Hello. Yes, I'm so sorry, Dr. Purnell, for your loss. I know this has been a difficult time for so many people and so much loss. So sorry for your loss. I do agree. What we know now compared to what we did last year is how deadly this disease is, and also how transmittable it is. I think initially when we first found out about the virus, they were saying that it would, go away quickly. It'll be gone by the spring, and that hasn't happened. And we've been taking all the precautions that we've been taking, and we still see how transmittable it is and how deadly the disease is. So for me, this is the main reason why I decided to come on today to speak with everybody, to just let everybody know that about the disease, the COVID infection, and also taking the precautions that are necessary, and also learning more about the different available options that you can take in order to prevent the infection, also to help end this crisis that we're in. So yeah, I think what the main thing is how transmittable it is and how deadly it is, with so many people have lost lives, the 50,000, 500,000 plus. Yes.
Yes. 1 year ago, and this is just a personal note, March 16th, I'll never forget it. I came home not feeling well. In a matter of a day, I had severe body aches, a fever of 102, and basically was paralyzed, immobile for well over 2 weeks. From that time up until now, it seems as though, doctors, that the symptoms have changed. What are the symptoms that doctors are seeing now regarding the virus? Has it changed? Has it lessened? Has there been peaks and valleys with the symptoms? Where are we now in terms of recognizing symptoms?
Right. I would say that initially our understanding in medicine, in public health more broadly, is that we were dealing with a respiratory virus, right? Of an illness that predominantly would cause respiratory symptoms and had a very infectious pattern. I'm describing the high fevers that you're describing, the chills, the body aches, the joint pain, the cough, the pneumonia. What we've come to understand is that coronavirus is not just a respiratory infection. Coronavirus really is a whole body infection. Coronavirus causes something called a cytokine storm. So it evokes a very strong inflammatory process in the body. And you see a host of coagulopathies, meaning the propensity for the blood to clot. So you see people presenting with, like my cousin, who unfortunately lost his life, a catastrophic and severe stroke, and also had a blood clot in his lung. So we definitely see those wider disease manifestations than just purely respiratory. So I've just described a stroke, which is a neurological manifestation of it. And you see these oddities around people losing a sense of smell or people losing a sense of taste. We didn't have that understanding very much in the beginning. That presenting symptom came to light as the numbers increased. And I would also say, in addition to adults that are largely impacted by the symptoms that I described, we've seen in children who have gotten infected and who have had very severe manifestations of the disease, also having this multi-system inflammatory process. And so it definitely does not only attack the lungs.
Dr. Lisa, what are some of the symptoms that you may have noticed with children and how it affects children? Or you're muted, Dr. Lisa. That's all.
Sorry about that. Yeah, so I think with children, just like Dr. Purnell said, the symptoms can vary with children. Initially, they were saying children were, barely like asymptomatic. They would have mild disease, mild symptoms. But as time went on, what they did see is that children can develop those rare illnesses, such as the multi-system inflammatory syndrome, where these particular children became very ill. Even though it was very rare, they became very ill. They had to be hospitalized. And sometimes they ended up with permanent damage, like of kidneys, the lungs, the heart, and they even had to be monitored for long time after they were discharged from the hospital. So I think for the children, they could show either mild symptoms, they could be asymptomatic, and they could show symptoms similar to what the adults would show. And a lot of the children, they came, I think, with a lot of gastrointestinal illnesses we saw with the children compared to with the adults. You might have seen a lot of the respiratory illnesses. And it's just the pattern of how the disease affect the body in children compared to the adults, like the MOB.
Okay. We've seen, it seems as though the media has shifted their attention from getting tested to now the number of people being vaccinated. Are we still emphasizing getting tested? Does rapid test give us the necessary information we need, or do we need a blood test? What would you all recommend?
Testing is still important. Testing is a part of what I will frequently say, bedrock public health measures to control the spread of this disease, right? To control the spread of the infection. We here in a hospital environment make testing available to our staff on a voluntary basis who feel they may have had an exposure or a high risk encounter. In the public, I recommend that people definitely, if you have any flu-like, any respiratory symptoms, definitely get tested. And I'm going to emphasize the and, recommend those who are asymptomatic, right? You have nothing provoking or nothing suggestive to you that you have an infection, you still should get tested. Now, how frequently should you get tested? There's a bit of a spectrum on that consensus opinion, right? How frequently should you get tested? What I tell people, and Dr. Jenkins can weigh on weigh in on this. There are certain people who get tested at least once a month, and then others who get tested every couple of weeks. You definitely should get tested after a high risk encounter or exposure, meaning you were within 6 feet of someone for 15 minutes cumulatively. You were not masked, that person was not masked, or neither of you were properly masked. You were exposed to, and that doesn't have to be someone symptomatic, just if you were in a high risk encounter or scenario with someone outside of your household is what I'm describing. And so in addition to that, if you have attended a large indoor event that is crowded, whether that is a funeral, whether that is a wedding, whether that is a gathering that had multiple households come together, I strongly encourage you to get tested, right? So what I just did is to give you an example of the different reasonings or rationale for how frequently a person gets tested. At baseline, you should have routine testing, but if you encounter or expose to someone with known or known disease or symptoms suspicious for disease, you get tested, or you're in another high risk encounter because you were unmasked, you were within 6 feet, you had 15 minutes of cumulative exposure, or you were masked, but in a very crowded indoor space, you should still get tested.
Yes, so I totally agree with Dr. Purnell. Yes, so testing is important because especially with this disease, it's highly transmissible. We already know that, and it can be deadly for many people that are at a high risk. So it's good to get tested because the only way, especially if you're asymptomatic and if you're positive and you are out in the public, and you have the infection, you can transmit it to a lot of different people. So by getting tested and you know your status, you can do the isolation that's required so you won't continue to pass on the infection. And also, if you are the one that is positive, you can let the people know that's close contacts to quarantine and also get tested. And I guess more with public health, you want to be proactive. So this is a good way to be proactive, especially with this disease that's very transmittable.
Okay, I want to push a little further in this conversation because we're getting reports now that the government is opening up, the reopening and the increase of percentage of people that going into restaurants, sporting events are now being able to have fans. And so where we've lived an isolated life, we're now giving a green light to venture out. But what I hear you all saying is we have to be cautious because being in an environment like that makes us susceptible. And I think sometimes we can miss we can sort of confuse what we're hearing with being practical in how we live. So can you all just sort of encourage those who are waiting to get out and hit restaurants and be amongst large groups of people? What precautions should they take?
Mask up.
Okay.
Always wear a mask when you are outside of your household, or put on a mask if there is someone in your household who is not of your household. That is just what we have to do at baseline. And I'm going to confess something here. I have not been in a restaurant. I'm not there yet. I don't think that the pandemic is controlled enough for me to frequent a restaurant. The closest I came was for my birthday. I ate outside in the cold, a slice of pizza. And so, but because there were just certain risks, and this is the equation that I always give people: is this a necessary risk? Right? And if it's not a necessary risk, you have to say, should I do this? My family, we did not mix households on either of the holidays. And that was difficult, especially in the first holiday season after having lost our dad on April 13th to this pandemic. And so there are things that you can do to keep yourself safe. And it starts with always wearing the mask when you're outside of your home, practicing frequent hand washing, and keeping 6 feet distance, right? Physical distancing is very, very, very important in trying your best to avoid crowded indoor spaces.
That's great. Lisa, let me ask you this. Double mask, I'm starting to hear and read reports about doubling masks. Now, it's already troublesome for some people to even wear a mask, but now they're saying double up. What's your thoughts on that?
I think double up. Yeah. So I agree with Dr. Purnell. If you don't have to go out, you want to avoid crowds, I would recommend the same thing. And also, they're recommending the double mask. And I think it's because, just like I said, it's the transmissibility of this infection.
Okay.
I know there's a lot of the variants that are going around, and they want to make sure, and I heard that some of those are even more transmittable than the COVID that's out currently. So, and I think what they're doing is they just want to just be extra cautious in order to try to get a handle on this, the virus. So they even recommend the double masking, even if you've had the vaccine, and if you've gotten the full doses of the vaccine, to still double mask. I guess just they just want to make sure that the vaccine is it's going to work, for and also they're preventing, I guess, creating that herd immunity that they're looking for. So I would recommend the double mask.
Okay.
Right. And can I just add something
Sure,
to that to
absolutely.
really help people understand? So for instance, why would I say I haven't gone to a restaurant? Because at a restaurant, I'm taking my mask off to eat. And there are other people in a restaurant with their masks off to eat. And it is likely, because I've seen restaurants picking up takeout. I still eat out, but I just do takeout. People who are within 6 feet of one another, and they are within 6 feet of one another for 15 minutes. And that's the cumulative period that increases your risk level of exposure, because we know this virus is something that's called aerosolized, right? So it is spread both by respiratory droplets, meaning as you speak, you have these droplets from, respiring, I should say, and it falls to the ground, or it falls to the surface. Then you have aerosolization, where the respiratory droplets remain in the air and they can travel. Okay. And so that's opposed to going to a grocery store, going to a pharmacy, or going to a shop where you need to pick up something for yourself. You don't ever take your mask off. That's why restaurants are a higher risk. And for me, that's why movie theaters would also be a higher risk, because people in these more social settings may take their mask off. You may take your mask off to eat snacks or to eat food. And so that's what you want to think about. What's some certain risks are necessary. So you have to go to the grocery store in order to eat. You have to go to the pharmacy oftentimes to get access to medications, right? So that is a necessary risk, but you do everything you can to ensure you have the most effective precautions. You're masking. And the reason why you hear people describing double masking is because it's very important for your mask to fit properly. Okay. And so where the double masking helps is that you oftentimes, a person may have, I have one here, the mask like this that are available in pharmacies and in hospitals, just a basic surgical mask. And if that doesn't fit as well, or cloth mask, and that doesn't fit as well, 2 masks give you a tighter seal, so that you know that you have proper fitting and that the droplets aren't able to get out, or you aren't able to inhale droplets that others have expired.
That's very helpful information.
Something else.
Sure, absolutely.
So, just like Dr. Purnell says, also the mask not only protects you, but it also protects others. So if you you might be asymptomatic, and see if you're carrying the virus and you're not aware of, you're not showing any of the symptoms. And if you're going out in public, and if you're talking, or you're socializing with someone, you can pass on that infection to someone else, and also your family members. So that's another reason why, it's good to wear the mask.
Okay. A couple more questions about the virus, and then we'll shift our conversation to the vaccine. If someone does test positive and they may have some symptoms, would you all recommend some kind of regimen for them to take? I remember when I had it, I took a little bit of everything and it still didn't help. But are there things that individuals can take now that can somewhat alleviate it if they're having some of the symptoms?
I'll tell you what the same advice and counsel that I give to others: keep yourself as healthy as possible at baseline. I really want to emphasize that. And I want to emphasize, eating a healthy diet. And I want to emphasize, physical activity. So that we learn ways to operate in our self-efficacy, the ability to make an informed choice or decision. So there have been studies that are emerging about whether or not the vitamin supplementation is helpful with those who have been infected with coronavirus, and we don't have data to demonstrate a strong positive effect. It doesn't mean that one person may not have a favorable benefit or outcome because of that, but across multiple people, right? We don't know that, hey, if you load up on vitamin C, if you load up on zinc, if you're loading up on vitamin D, that you're going to have fare better with the coronavirus infection. We just don't have the conclusive data of that yet. But we do know that as much as you can do to be healthy at baseline is a benefit for you in warding off any infection. That's why I want to stress and emphasize that. And then two, when you're battling with coronavirus, you want to make sure you're staying hydrated. So you're drinking fluids as you can tolerate. You want to ensure that you are I don't have one on me, but I always recommend to people to have a pulse oximeter. So it's a way for you to check the oxygenation status in your blood.
And Dr. Lisa, Dr. Chris, so what does that do? What does that, because people have seen the little
Yeah, that's what I was just getting ready to describe, right? So
right.
It's a way for you to check the oxygenation status in your blood, and it is a way to assess, right, if you're struggling. So if you're able to breathe in and you're able to have good air exchange in your lungs, you know that you have oxygen binding capacity in your blood, right? Okay, and so as that oxygen enriched blood is traveling throughout your body. That's how human beings live and function at baseline. So when I'm measuring, using the pulse oximeter and measuring my oxygenation status, it can suggest or indicate how severe my disease is, or if my lungs are very inflamed or infected, if there is a large disease burden. If you don't have that, there are other things or signs you can look for in your body, bluish or dark colored lips. And that's something to indicate that you're not able to, oxygenate as well as you should.
Okay. Dr. Lisa, you want to add?
Yeah, so I agree with Dr. Purnell. Also, what I was going to say, since so many people are asymptomatic, if you do test positive, like happen to test positive, to just make sure that you stay home, like isolate yourself from others, because you don't want to pass on the infection. If you are having symptoms, like some of the common symptoms, like the respiratory, just like she said, staying well hydrated, treating the symptoms is important. If you're found that your illness is not getting better, it's getting worse, keeping in contact with your doctor, they might make recommendations. There are some treatments that are available now, I guess, that are approved by FDA for emergency use only. So your doctor will be aware of that. So if you're having any severe illnesses and your illness is not improving, it's good to, get in touch with your doctor, because they might recommend you to go to the hospital or to get a certain treatment. I don't want to go into a lot of the treatments because I don't know how much time we have.
And just one other point on that I think is important, because I think a lot of people in the community don't know this. The conversation or the dialogue with your doctor is critical, because your doctor can also evaluate if you're a candidate for monoclonal antibody therapy. And that is something that a lot of physicians and patients in community don't know the full detail or information around, to say, hey, is this person a candidate? And this is not for someone who's hospitalized. I'm talking about for people who are sick and infected with coronavirus in your home. Right. So that's why I just want to emphasize and stress the importance of, even if you've tested positive, communicating with a provider.
Okay.
I was going to say, I'm going to add on to Dr. Purnell, because some of those treatments, they need to be given early in order to,
within 10 days.
Yeah, in order to make a real difference. So that's why it's really important to keep in contact with the doctor.
Okay. I was going to ask this question. What if there's someone watching, or we have family members who do not have a primary care physician? Would you recommend hospital or an urgent care?
That depends on what type of symptoms you have.
Okay.
Right? That really depends on how you're presenting. If you're struggling to breathe, you need to call 911. Okay. And you need to be evaluated in an emergent basis, on an emergent basis. If you're dealing with flu-like symptoms and you don't have a provider, yes, you can go to an urgent care facility. And during the pandemic, we definitely have seen the explosion of telehealth or telemedicine, the opportunity to have virtual care visits over your phone, over your computer, or your laptop. It is good to be evaluated by someone to say, hey, this is how I'm feeling. This is how my symptoms may have changed from day to day, and someone to be able to demonstrate accountability over the illness, and for someone to teach you when you need to escalate or when you need to be seen emergently.
Okay. And if someone does not have, let's say someone is undocumented, no health insurance, are hospitals required to treat them?
Oh yes, you can't turn anyone away
Okay.
who it comes through an emergency room by
Okay.
EMTALA. You have to treat them and stabilize them. And here at University Hospital, we treat every person regardless of ability to pay or insurance status. University Hospital is the largest provider of charity care in the state. So if you're undocumented and you're sick, you can come to University Hospital and you will be taken care of.
Thank you.
Yeah,
Thank
and
you.
I just want to piggyback on what Dr. Purnell was saying. I know at the beginning of the pandemic, a lot of times, a lot of the people were told, if you get COVID, just stay home if you start having symptoms. This is before a lot of the testing was done, and a lot of people stayed home and a lot of people died. So that's what I was going to say. It's very important to keep in contact with your provider. And if you're really ill, to seek care at the emergency room. Don't be afraid to seek care.
Okay.
It's safe.
Yeah.
Thank you. Thank you. Let's shift our conversation to the vaccine. Let me just throw this out. Can we trust it?
Yes.
Let's
Can I say that emphatically?
Please,
yes, we
let's have that
we can
discussion.
trust it, and let's have that conversation from a very informed place. I understand why in Black and Brown communities there is concern, there is fear, there is skepticism. Skepticism is at an all-time high in the United States because of how activities around the pandemic were overtly politicized, right? That drove skepticism through the roof across the American public. But for the Black and Brown community, imagine when you have experienced the collective trauma of witnessing or have loved ones or anyone in your lineage or an ancestry that has experience medical exploitation, medical experimentation, that is not something you just forget or get over. The system in many ways has taught Black and Brown persons through medical abuses that the system is not trustworthy, okay? And so we can point to the enslaved Black women who were used by Dr. Sims to perfect gynecological surgeries. And obviously they couldn't give consent because their humanity wasn't respected, but those procedures were done without anesthesia. We could talk about Tuskegee, the infamous Tuskegee syphilis study, where you have almost 600 Black men, many of which would serve their country, have syphilis and have treatment withheld in order to study the natural progression of the disease. You could talk about Henrietta Lacks, a Black woman in segregated Baltimore who had metastatic cervical cancer, who had tissue samples taken from her womb without her consent, without her knowledge. And those tissue samples go on to produce miraculous medical discoveries and marvels. I could talk about Mississippi appendectomies, where Black and Brown women were forced to undergo sterilization under the guise of some other medical condition or ailment. That has taught Black and Brown people not to trust. Trust isn't free. And so I start there. I say it's safe knowing all of that. I say it's safe having experienced implicit bias in American healthcare myself, right? Because it's not just the past, it's what we deal with day to day. Racism is a system, hence systemic racism. Hence it impacts every sector and every aspect of American life, right? So it's not just history, it's what's current. And so the mixture of that has caused more Black persons to be in a category that we call wait and see. And I want people really to understand this. Yes, there is some hesitancy there. And it bothers me to even use that word because it falls on the side of blame, unfortunately. But there is a lack of willingness, a lack of ready willingness to get vaccinated because of what I've just described. It is a learned response. It is a rational behavior to say, can I trust this, right? And so what we need to be able to do is to be able to break down the science in easy to understand, plain spoken terms, and not just what the science is, but the ethical process around the pursuit of science itself. That's why I enrolled in a Moderna COVID-19 vaccine trial. I lost my father. I saw so many Black and brown patients in our hospital here impacted. I saw my community more broadly devastated, disproportionately. I want to emphasize that, disproportionately devastated. So I needed to be able to demonstrate accountability. And my way of demonstrating accountability as a public health physician was to volunteer because I'm aware of the inequities. And if Black and brown folks don't participate in clinical research, the inequity is perpetuated, right? Because we don't have a way to say that the results are generalizable. Now, I could go on and on. I'm not seeing race as biology, but I'm talking about geographic ancestry and how that impacts how whether treatments or interventions are evidenced the same in all groups, right? So with all of that being said, we must approach our brothers and sisters in community with an understanding of a fear. We must approach them with empathy and an understanding of a concern. And knowing all of that, I still say emphatically, 100%, the vaccine is safe and the vaccine is effective. Because I've looked at the science myself. And the scientists across multiple, you could say bodies, investigative bodies, have verified the science. And that's why I feel comfortable saying that. But you can't say that to Black folk without recognizing their history or the trauma that we experience through racism on a daily basis.
Dr. Chris, I'm going to say amen to that. You just preached a sermon and you don't know it. Thank you. Dr. Lisa, let me ask you this question. To those who are concerned about this vaccine possibly affecting their immune system long term, what would you say to that?
Well, to be, I don't know if there's enough research to say that. You know what I mean? So I think what I understand is that that they're constantly monitoring the effects of the vaccine by monitoring the people that have received it. And I can speak with Dr. Purnell. I do feel I know everybody has to make their own choice, but for me, I do feel that the vaccine is safe. And I did research the vaccine before I did, because I did receive the vaccine also, not in the study, but I received it just recently when it was eligible for me to have it. And I, just like I said, each person has to make that decision. And for me, what I did is I researched, what are the, benefits and the risks of catching the COVID virus and having maybe one of the long-term side effects or not making it through on conquering the virus with my own immune system. So I decided to take the vaccine. And I think each person has to figure out how are they going to make it out of the pandemic. So we done the precautions, we did the social distancing, we did the, avoiding crowds, we did the masking up, but the virus is still there, right? So what's the second thing that we can do is to get the vaccine. So in order to have something that we in our own immune systems can fight off the virus if we do get it. So I think each person has to kind of weigh what's the benefits and what's the risk of getting the vaccine or, doing the precautions, in order to make it out of the pandemic, or, you know what I mean? So I think that's the way I looked at it when I decided to get the vaccine. Okay.
No, go finish your thought.
Yeah, so I mean, that was my reason why I decided to get the vaccine. And when I did get the vaccine, I can let people know I got the Moderna. The first shot, I had some soreness on the site where I had gotten the vaccine. It lasted for maybe about 24 hours. The second vaccine, which was the 28 days later, they did tell me it was going to be a little punch. So I did have some of the, the soreness at the site, and I felt like tired and fatigued the next day. And then after that, I was fine. I hadn't had any complaints. And what I noticed is that when I did get the vaccine, after you get it, they watch you for like the 15 or 30 minutes just to see if you're going to have a reaction. And they had us sign up at my site where I got it, something called, I think it was the V-Start. It was like an app. And what they did is that they actually checked on you to see how you're doing. Like they check on you the day you got the vaccine, that whole week. I think mostly every day they check to see how you were doing. They ask you these questions: are you having fever? How are you feeling? They gave you like emoji sign, good or bad. And then they kind of reminded you when to get the second vaccine. And even after the second vaccine, they tried to find out, what you were doing. And they even said that if they felt that you were had a reaction to it, they would give you a call, right? And even with the vaccine, if you do have a reaction to the vaccine, they recommend reporting it, right? So this is another way to see if the vaccine is safe for everyone. So you can report it to like on one of the, I think it's the adverse, the vaccine site, just to kind of keep a check on the vaccine and see if it's having any problems. So then they can let the public know. So if something changes need to be done or if the vaccine needs to be stopped. So that's the reason why I chose to get the vaccine. Okay. And also I know it's safe because they're doing all these checks and monitoring throughout the whole time, for everyone.
Okay.
So can I add
go ahead. No, absolutely.
I put in, because I think it's important for people in the public to have access to information, because this is how misinformation is able to get a foothold, because people don't have the actual information to weigh and judge. So it's just two very important things that I want to say to folks. I heard Dr. Cameron Jones, and Dr. Cameron Jones is like, the greatest thought mentor that I could ever have had as a public health physician, an epidemiologist, preventive medicine by training like myself. And she says, as a Black woman, the calculation I had to make was, what was my risk of exposure, right? And so what stats tell us is that Black and brown people are exposed to coronavirus at higher rates because of something called social determinants of health, where they live and where they work. Black and brown people work in service and production industries, meaning that they work in jobs that are oftentimes considered frontline or essential, jobs that you also can't work remote, jobs that you have to show up for in person. Black and brown people work jobs not only that you have to show up for in person, they have jobs that aren't at a living wage, right? So do they have access to appropriate PPE or appropriate income protections? So your job in and of itself could expose you. One of my cousins that I lost was a postal worker here in Newark. So he was on the front line, okay? My sister, who is what we call a COVID-19 long hauler, got exposed at her job. Her job, she's in a large retail chain industry and didn't have appropriate access to PPE. So Black people are at higher rates of exposure. And I'm gonna put a link in the chat box for everyone to see how the CDC broke this down. Not only at Black people at higher rates of exposure, exposure is equivalent to infection. Think about it that way. Black people are at higher rates of hospitalization. Black and brown people, the number has fluctuated, has gone anywhere from 3 to 5 times higher than white Americans. Okay, not only are Black and brown people at a higher rate of hospitalization, Black and brown people are at a higher rate of death. So you take those risks cumulatively. Risk of exposure. And the other thing about that drives your risk of exposure up is not just where you work, but where you live. And Dr. Jenkins was talking about this earlier. Black and brown folks, even across socioeconomic statuses, oftentimes live in multi-generational homes. Okay, so if you have people across different age categories, risk can be perceived higher for others, dependent on age and disease conditions. But also, if you live in a very small place where you can't properly quarantine or isolate it, one person in your house, you all are exposed, okay? We bear disproportionate risk. So when a person is making a decision about whether or not to get vaccinated, my job is not to convince you, but to ensure that you know the risk that you are taking. And what I want people to understand is that Black people are oftentimes in polling data are in a category called wait and see. Black people are not saying, I'm never getting vaccinated. Black people are not saying, I'm only getting vaccinated if you mandate or require, but Black people are saying at higher numbers, I'm in a wait and see. So they have informational needs. We have to be able to explain this vaccine in plain spoken terms, the messages that resonate with people making a decision, because everybody's on a decision journey, right? The messages that resonate with people, they want to hear, if I take this vaccine, what's long-term immunity? Dr. Jenkins told you, we don't have that data yet. We know it's safe across the period that people have been followed. The first persons to be injected in early phase trials, we're about to come up on that March, okay? We know that most immune-mediated side effects happen in the first 2 months, 6 weeks to 2 months. So if you're going to have an immune-mediated side effect, it's most likely to happen in 6 weeks to 2 months. That's what science has taught us. Decades of vaccine research has taught us that, right? But we can't say definitively, this is your risk a year out, this is your risk 2 years out, because we just haven't gotten there yet. I'm being followed. I was vaccinated on August 31st and October 2nd, and I will be followed for 2 years, okay? Because there were no serious medical events in those first 6 to 2 month periods, the FDA said, you know, if you give me 2 months worth of safety data, I will approve you under emergency use authorization. And that's what the FDA was able to do. So we are confident that there won't be long-term risk, but we can't say that conclusively. So you weigh the risk of exposure, the risk of hospitalization, and the risk of death against the risk of an adverse effect. And I'm not talking about side effects. Side effects are normal and routine, just means your body is working, your immune system is working. So you weigh those risks that I just explained against a risk of something very bad happening to you. There has not been anyone who has died, whether in a trial or since vaccinations have been made available to the public, that we can definitively say was caused by the vaccine. That has not happened, but that's being described. Persons who have had Bell's palsy, where you get paralysis of a portion of your face, has not happened at a higher rate or number than has happened in the public with anyone who has not been vaccinated. So I just wanted to make sure people understand that.
Thank you. Thank you. So we have 3 vaccines. Go ahead, Dr. Lisa, absolutely.
Also, what got me too is that if I did get the virus and I did survive, but I experienced any of the long-term, the long hauler syndrome, or some of the long-term effects of the virus, like lung damage, or some kidney damage or heart damage, how is that going to? How would that affect my quality of life? Would I be able to still work? You know what I mean, and serve my the population that I'm serving? So that helped. Still the deal for me.
Okay. I was going to ask this question. So dealing with the FDA, we have 2 vaccines out for the public now, the Pfizer and Moderna. Reports are having that at the end of March. Johnson & Johnson will have a vaccine out, 20 million due to be shipped, 1 shot. I've already begun to hear the skepticism of 1 shot is less than 2, which makes it less effective. Can we have a discussion about the effectiveness of these vaccines hitting the market?
Sure. So the 2 vaccines that have been approved today under emergency use authorization are both mRNA, messenger RNA vaccines, so by Moderna and Pfizer. Okay. Those vaccines were based on a technology that we've had for about, that we've learned from for about a decade worth of work in the lab. It's very important for me to say that, because we didn't just discover this technology. While these vaccines were produced quicker than other traditional methods we have used, that is because of the science, the nature of the technology that these vaccines were produced by, and the leg up that we have with at least a decade worth of research. You can even go back further, like 3, almost 4 decades, where people first started to discover how mRNA was working and if you could use it in a vaccine. So with that being said, those messenger RNA vaccines are 94 to 95% effective at preventing symptomatic disease. Okay, so that means you will have symptoms from your infection. That's what the science showed us. What we're still learning about these vaccines is how good are they at preventing asymptomatic infection and asymptomatic spread. Data is emerging that shows that they're most likely are going to reduce asymptomatic spread from a person who's been exposed and infected but has no symptoms to someone else. So not only are the vaccines good, 94 to 95% effective at preventing symptomatic disease, they are, it looks suggestive at reducing the likelihood that you could transmit the infection to someone else. We can't say that conclusively, but it's likely. And the last thing that I'll say on this, because this is what gets people about the J&J. The endpoints are different in how they described it. Moderna and Pfizer says symptomatic disease. J&J says severe infection. So J&J is 85% effective in preventing severe disease. So meaning it's going to prevent you getting hospitalized. It's going to prevent you from being on a ventilator. It's going to prevent you from dying, right? So that 85 is powerful. It is still a powerful tool, and it makes it a very attractive option because it's one shot, because its refrigerator shelf life is far longer and far greater. So it can be used in different mobile settings and scenarios. And the last thing is both Pfizer and Moderna also show, they look at those in the vaccinated arm. So I was in the Moderna study and I found out once it had gone through emergency use authorization that I actually received the vaccine and not the placebo. So we know that if you look at those in the vaccinated arm versus those in the unvaccinated arm, meaning people who just got placebo or saline, that Moderna is almost 100, if not 100% effective at preventing severe disease. So that's how people should think about it. These vaccines are going to keep you from being hospitalized, keep you from being very sick in a hospital, and prevent you from dying.
Thank you. Dr. Lisa, anything to add?
I was going to add, I think a lot of people get stuck on, oh, I want this vaccine, I want this one or this one. I don't know if, I don't know how Dr. Purnell feels about this, but I don't know if you're going to have a choice when you become eligible for the vaccine, because the vaccine is in so demand, like not only in the US, but also in other countries. So I'm not sure if you'll have a choice when it becomes eligible to you to decide, I want to get the Johnson & Johnson 1 shot over 2 shots. Now, only way I think it might be a little different if there's some reason where you might not be able to take the Moderna or the Pfizer.
Maybe if you have an
allergy or something, and then you might not have a choice to get the Johnson & Johnson. That might be the only way that you might have a choice, but I don't know if you'll have a choice. The way these vaccines are rolling out and the demand of these vaccines throughout the world. So that I think people just have to kind of do their research for all the information that's available for all the vaccines, and then make a decision.
Yeah. When you're eligible to be vaccinated, you should be vaccinated with what is available to you.
Okay. So when you can get it. Take what you can get. Okay. Dr. Lisa, let me ask you this. Being a pediatrician, there aren't vaccines out yet for children. Do you know if scientists are working on that?
Yeah, what I understand, and hopefully Dr. Purnell will share some information too, is that the Pfizer and Moderna are starting to do the 12 years and up. 16 and up is available for the Pfizer, and the Moderna is 18 and up. That's only if you're eligible to receive it at that time. So there's each state, I guess, have their eligibility. So what I understand is that maybe by the end of the summer, they might be something for that age group of 12 and up of the Pfizer and the Moderna. I'm not too sure if Johnson & Johnson has worked on anything yet because they're not officially approved yet.
Right. So there is, I wanted to, because I'm all about sharing information with people. And so Pastor, hopefully we can disseminate these links that I'm putting in. Many of them are from the CDC, a trusted site that people can get accurate information from. What Dr. Jenkins said is spot on. So Pfizer was tested in a 16 to older age population. Moderna was tested in an 18 to older population. So the only people who could get the vaccine are those whom the trials were tested in, right? So for Pfizer, 16 and above, for Moderna, 18 and above. Both Pfizer and Moderna are looking at that 12 to 16 in the case of Pfizer and 12 to 18 in the case of Moderna age interval to be able to demonstrate whether the vaccine is safe and effective in those age groups. As that science comes to bear, as that science is produced, then the drug companies will begin to look at trials that involve progressively younger age groups. So that will be even further past the summer for those younger age groups. But for adolescents, hopefully by summer, we will have a bulk of information. We'll be able to begin to offer vaccinations to eligible persons in those age categories.
Okay. But women who are pregnant, is the vaccine safe for women who are pregnant? Is there any data or research?
Yeah, I can start. I'll start.
Okay.
So it was very, I want to teach people how science works. So when the FDA had the emergency use authorization process, right, that was for career scientists to pour over the data and to say, okay, what the drug company published, is it accurate, right? Is it scientifically sound? Were all ethical guidelines followed? That's the FDA's role. And then in addition to those career scientists, there is an advisory panel body that the FDA has independent scientists to likewise look at the data. After the FDA gave the emergency, the approval that yes, this should progress for emergency use authorization, the CDC has an advisory panel that begins to look at and make recommendations for which groups should be vaccinated and who it should be eligible to. The first signal that there weren't going to be groups by certain conditions that should not get vaccinated was the fact that the CDC did not say pregnant or lactating or breastfeeding women should not receive the vaccine. So when they didn't say that, the scientific community said, okay, this is interesting. Then ACOG, right? So the types of doctors, obstetricians and gynecologists who focus and specialize in taking care of pregnant women, they came out and said there is not a contraindication for pregnant women to receive the vaccine, meaning that there is not a no, just because you're pregnant, no. What they said is you, in discussion with your provider, shared decision-making, should weigh the risk versus the benefits and then make a choice about whether or not vaccination is safe. What we know is that when pregnant women do contract coronavirus, they can have more severe cases of the infection, right? So that's a part of that risk benefit. While pregnant women were not studied at that point, there wasn't anything in the broader categories that were studied that would be suggestive that it would be a harm to a pregnant woman or her unborn child. But with that said, there are now studies, at least Pfizer, I am aware of, that is going to launch in pregnant women, looking at the safety and efficacy specifically in pregnant women.
Okay. Listen, we're nearing the 7 o'clock hour. Just a couple of more questions and we'll wrap it up. To the individual who has received both vaccines, can you share some information as to how they should live? I know that some are letting their guard down, feeling free, live how they want to live, even without a mask. Can you sort of share some information about the importance of still being masked up and precautions they need to take, even though they've been vaccinated? And then I guess my last question, I'll get to both of you, is when do you, and I know it's hard to sort of project, but is there a timeline for a return to normalcy based upon this herd immunity? Do we have a time frame in mind?
Okay, so I'll start since my mic is open. Let me take the second part first, because I really want to make sure. I don't know that we will ever get back to what we were before, right? Because frankly, if I describe baseline normal was rife with problems, right? What we've seen through the pandemic is a collision of this slow pandemic of systemic racism with this fast pandemic of coronavirus. And we've seen worse outcomes for Black and brown groups. And it has ripped the veil off of the sense that the American healthcare system doesn't struggle with implicit and explicit bias, right? So I hope that we use this moment to destroy normal in many ways, right? So that equity becomes the focus of our work. But if we'll ever get back to where we were before, I'm not sure. Will we get back to where we can consider not wearing our mask, where we can consider doing group activities, outdoor activities? I think we will. Yes, okay. But it will come with precautions, right? It will come with guidance. And to the other, and I'm not going to, prognosticate on when that is. I'm just going to say we're not there yet. And I'm just going to say, hold the line. And I'm going to say, hold the line. And I'm going to say, hold the line, meaning wear your mask, wash your hands, practice physical distancing, and avoid indoor crowded and cramped spaces. I still wear my mask. I've been fully vaccinated since October. I've known that I was fully vaccinated since January. And so even those of us who have received 2 injections and have gone the additional 2 weeks for your immune system to be fully mature in its response, we need to continue to follow those public health guidelines and measures.
Dr. Lisa?
Yeah, I totally agree with Dr. Purnell. I don't know if we'll ever get back to a normal, maybe a new normal, only because so much transpired over the past year and so much loss, like so many individuals that have lost. And I'm just thinking about even going back to work and just seeing about the toll it is taking on my colleagues. Like, are they going to be there? Like, the ones that maybe I passed at the in the kitchen, as I go by. I don't, because you hear about so many people are dying, and, when you go to some of the meetings, you're just like, oh, that person died. Oh my gosh, they died. So I don't know if it'll ever be back to a new normal, and especially with the children. I can't even imagine the mental health that, getting back to the schools and then seeing the kids and what they've encountered being at home. And I just don't, I can't see it going back to like it was before. And just like Dr. Purnell said about the racial and the disparities, but I guess a silver lining would be that hopefully now that a light has been shed, maybe changes will occur and these changes will stick when it comes to disparities among African Americans, because I'm just thinking about the devastation that this disease has had on us. And a lot of it is due to those disparities that we've encountered throughout the years, the health disparities for a lot of individuals that died, that might not have died if they hadn't had those health issues. And then I think the second one was about masking. Yeah, I think we have to continue to wear the mask, double masking, because we still, there's still a lot of unknown. We did those precautions at the early part of the pandemic, and there was still a number of deaths, and the disease continued to press on. So I think we have to see, get an idea of once a large percentage of us are vaccinated, just to see if the disease, hopefully it'll break the cycle of infection, that we can see if we can eventually take off the mask. But for now, especially with so many people that are still needing to get vaccinated, I think we have to continue to wear the mask.
Okay. Any parting words you all want to leave with our viewers before we end this webinar? Other than mask up?
Yeah, other than the public health measures, I would say together we can get through anything. And that's coming from a woman whose family has experienced a lot of loss due to this pandemic, but still who is overwhelmingly hopeful and overwhelmingly vigilant. And that if you don't understand or you have questions, make sure you're going to people that you can trust and who have done the homework, right? Those two things should come together, that you trust and who have done the homework, meaning they understand the science around the pandemic, and in particular the science around the vaccines, and hold us all accountable, hold me accountable, hold healthcare accountable, hold the nation accountable, because we can and we must do right by all of humanity. Equity, racial equity, health equity must be at the center of all of our dialogue and actions going forward.
Yeah, so I agree totally with everything that Dr. Purnell said. I also want to give a disclaimer before I leave them. I do work at the Department of Health in New York City, but the information that I provided today is no reflection on the New York City. So I just wanted to give that disclaimer. But yes, I do agree that at the end of the day, it's a personal decision you have to make, and you have to take into consideration the impact of the virus has had over on your family and your friends, your colleagues over the past year. And what is your role in helping to, prevent the infection from continuing? So I think do your research, go to reputable sites to get the information. The CDC is a good site to go and get information. It's always updating information. And then take the precautions until we get a hold on this. Listen to the professionals and take the precaution, masking up, avoiding crowds, avoiding places that you don't need to go to, that's not an emergency to go to. And if you do get infected, do the isolation, do the isolation. And if you're really getting sick, seek care, with your provider. So that's, I guess, the bottom line.
Okay. Well, Dr. Purnell, Dr. Jenkins, I want to thank both of you for taking time out of your busy schedules just to share information with our community. To our audience who is watching, we want to let you know that this webinar was sponsored by the New Jersey Black Empowerment Coalition. There are countless issues that our communities are dealing with, and we want to spur that dialogue. So be on the lookout for our next webinar. But for tonight, we say good night. And again, we thank Dr. Purnell and Dr. Jenkins.